Hi everyone, thank you for joining us today at our September Lunch and Learn on CPR and AED Basics, presented by a CPR instructor here at Good Shepherd.
Thank you for joining us today. I'm Tricia Wattenburger, and I'm a CPR instructor here at Good Shepherd. I've been teaching CPR and first aid and our babysitting class, as well as our healthcare provider BLS for almost 10 years. So I'm glad to be able to just give you an overview today of CPR, when we need to do CPR, how to do it, and then the steps that might follow, as well as the use of the AED. So that's one that a lot of people have questions about, how to use the AED and is it safe to use? So we'll talk about some of that. Keep in mind, this is not a certification class. If you'd like to get certified for CPR, we would love to have you join one of our classes, and you can call our office, which that information will be provided in the information, the details, notes. And so we can get you signed up for a full CPR class and get you certified if that's what you would like to do. So CPR stands for cardiopulmonary resuscitation, that we are helping someone's heart to beat when their heart has stopped. That would usually be if they're in cardiac arrest. So they're doing their life, going about life, and they collapse on the ground. We want to be able to keep their heart beating to keep them alive until help can come. So we want to know, when do we do CPR? Like I said, it's when someone collapses. And then we also are going to go through some steps. These are our steps of CPR. And so we'll go through these steps, and it'll help us to assess, do we need to do CPR, or should we just call for help, or what are the steps that we need? So if you are with someone, say you're with a friend and you're talking and visiting with them and they collapse, the first thing that you need to do is check for scene safety. So we want to be sure that when you go to help this person, you aren't going to be injured, whether you're in a parking lot and there could be danger from a car, or water and you might slip or something. So we're just doing a quick look around. Just takes a few seconds to make sure that you're not going to be injured by helping this person. And then we're checking for a response. We want to make sure they aren't taking a nap. So we want to just check and see, will they wake up if I check on them? So with that, that's the tap and shout, where we tap firmly on the shoulders and we shout, hey, are you okay? Are you all right? So if they're not responding, we know that we need help. At this point, you would call for help. If you're alone with an adult victim, you're going to get your cell phone and you're going to call 911, preferably put it on speakerphone on the ground next to you so you can get started with CPR if you need to. But if there's someone with you, you can send that person, say, go call 911 and get an AED. In public places, we should be able, hopefully, to find an AED. Large stores are required to have them. Many public places will have them, and so try to send someone to see if they can find an AED. And so we want them to go and call 911, get an AED, and come back. Once we've got help on the way, the next step is that we're going to check for breathing. So we want to see, do we actually need to start CPR? If our victim is not breathing, that is a good indicator that they don't have a pulse. So we're going to need to begin CPR at that point. So we're looking for 5 seconds, no more than 10 seconds, just watching for that regular rhythmic chest rise. Gasping, where they take one breath, and then there's a long pause in between, and then there's another breath after a while. That doesn't count as regular breathing. Regular rhythmic breathing. If we don't see that, we're going to begin CPR. Compressions first. And CPR should always be done on a bare chest if you can. If you can get bulky layers out of the way, that's best at first. So get jackets, unbutton buttons or snaps, undo a zipper, so we can do our compressions on the chest. You're going to use the heel of one hand. I'm right-handed, so I use my right hand first. Your other hand is going on top, and your heel should be on the sternum, the breastbone in the center of the chest. Your middle finger lined up at about the nipple line, so you're not too low or too high. If you're too high on the chest, your compressions just won't be effective. If you're too low, there's a little piece of cartilage at the bottom of the sternum that's called the xiphoid process, and we don't want to push on that. We want to be right in the center. The sternum is very strong, so we can put pressure on that and not cause issues. We also want to keep our fingers lifted up off of the chest, so we're not having our weight over onto the ribs. then we become much more likely to break ribs. So your one hand down, second hand on top, lifting your fingers up, and then beginning compressions. When we're doing compressions, you want to keep your elbows locked. So we're not bending our elbows to do our compressions and trying to use our own strength. We're using our body weight and compressing at least 2 inches in depth. And it's a pretty rapid speed. It's 100 to 120 compressions per minute. And so one set of compressions should take between 15 to 18 seconds. Okay, so I'm going to show you one set of compressions, counting out loud. We do 30 compressions for a set. So here's our first set of compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, after 30 compressions, we're going to pause and we're going to do 2 breaths. So we've got here begin CPR, breathing, compressions and breathing is our CPR. Anytime that you're doing anytime you're doing breaths, you should have some sort of barrier device. A pocket mask is a really common type of barrier device. It has a filter in it to protect your victim from getting any germs from you and to protect you from getting any germs from your victim. So that would go directly on the face, and we would press it against the face and lift up the chin to open the airway and then give a 1-second breath. You should be able to see chest rise. 1, 2. It's just a 1-second breath. We're not blowing up a balloon, just a little breath to be able to get that chest to rise, and then a second breath and back to our compressions. Another option, if you don't have a pocket mask, I don't have a pocket mask in my purse. It's too bulky to fit in my purse, or even sometimes in my glove box that I have too much junk in there. So I want something smaller. You can buy these little face shields that will be similar. They have a HEPA filter in the middle, and that will go directly over the mouth. In this instance, you have to also plug the nose when you open the airway. So one hand is plugging the nose, and then the other hand is lifting at the chin, forming a good seal around their mouth. And again, you should see that chest rise. 1, 2, and then back to our compressions. Okay, now that took me way too long to do breaths. In a real sequence of CPR, it should be 30 compressions quickly, 2 breaths, 1, 2, and then back to our compressions. And that should take no more than 10 seconds. So it's got to be a really fast, quick transition. So we're going back to 30 compressions, 28, 29, 30, and 2 breaths. 1, 2. Okay, and right back to compressions. With an adult victim, we're going to continue our compressions and breaths until that AED arrives. So if you've sent someone for help, they go to customer service in the grocery store, wherever you are, they bring you back the AED. Now, like I said, the AED can be a little bit intimidating. Most people probably are really afraid to use the AED because we know that it provides a strong shock to our victim, and we don't want to hurt our victim. And so it can be scary when we turn on the AED and it tells us that we need to give them a shock. Most of us have seen those medical shows where they put the pads on and then they kind of jolt when they shock them. We don't want to hurt our victim, but the AED really is very safe to use and it's very effective. It makes our CPR even more effective. CPR on its own is effective, so if you don't have an AED, just continue doing CPR. But if you can add in the use of the AED and deliver that shock to someone in cardiac arrest who needs it, it can be much more effective in the long run. And it increases our chances of recovery for our victim. Oops, sorry, Annie. Okay, so when you get the AED, no matter where you are in your sequence of compressions and breaths, you're going to stop what you're doing and use that AED. So if I'm at 16, 17, and someone brings the AED, I stop, I turn it on. We have a power button here.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
All right, and then I'm going to just follow the prompts that it tells me to do. So it's telling me to apply the pads to my victim's chest. Our pads
Apply pads. Plug-in connector.
They show where they go. So this one shows right shoulder. This one shows left side under the armpit. And then your AED.
Apply pads. Plug-in connector.
The AED has a flashing light here that shows you where you'll plug in that connector. And he'll keep reminding you until you plug it in. Here it's plug in.
Analyzing heart rhythm.
Okay.
Do not touch the patient.
It's my job to make sure no one is touching this victim while it's analyzing. So everyone stay clear.
Shock advised. Charging.
Okay, again, everyone stay clear.
Stay clear of patient.
We're going to shock.
Deliver shock
the button.
now. Press
Everyone's
the orange
clear.
button. Shock delivered.
Then you can immediately resume
Begin
compressions.
CPR.
So I'm going to pause there. I'm going to actually turn off my AED so I can tell you something about it. In a real scenario, if you connect that AED, you're not going to turn it off. You're just going to leave it on and let it keep going. Every 2 minutes, it will reanalyze and it will reevaluate to see if they need a shock. So some information about the AED. Like I said, it's very safe to use. It's 99.9% accurate. And so if you connect the AED to a victim, it's looking for a very specific heart rhythm, ventricular fibrillation, that is associated with a cardiac arrest. And the AED will not shock someone that does not have that specific heart rhythm. So if you connect the pads to your victim, you plug it in, and it analyzes and says that they need a shock, you can trust that you're doing the right thing by delivering that shock. We want to be sure no one is touching our victim when it analyzes, so it's only getting our victim's heart rhythm. If this is my friend and they've collapsed and I'm holding their hand while the AED is analyzing, it's analyzing my heart rhythm as well. So it's really important that we keep everyone clear while we analyze. And then, of course, when we deliver that shock, we also need to make sure that everyone stays clear so that we're not accidentally shocking someone who doesn't need that shock. So that's kind of an overview of the AED. Like I said, it's very accurate. It can increase or will increase the rate or possibility of survival in our victim. It will reanalyze every 2 minutes and reassess their heart rhythm to see, if they need another shock. It's not uncommon to need more than one shock, and so we'll just let it continue analyzing, and we'll continue with our CPR. Okay, so 30 compressions and 2 breaths. We do have in our AED, in this one, and a lot of AEDs out there are going to have child pads. Child pads would only be effective for a child 7 years old and younger. So I have an 8-year-old daughter. On an 8-year-old, we're going to use the adult pads. It's the only time an 8-year-old is considered an adult, despite what they might think. But we're going to use the child pads on 7 and older. 7 and younger, 7 and younger. And you can tell they're a little bit different. If you can see these on the screen, they show that they'll go in the center of the chest and the center of the back on a child. For our pad spacing, we have to have an inch vertically and horizontally between our pads. So we need to have some space in there. On a little kid, they're going to be too small to be able to fit those pads on the left side right shoulder. So that's why we would do that alternate pads placement. So there's our AED. Like I said, as soon as you press that shock button, you can resume your compressions and breaths, getting right back into your CPR and stopping when the AED tells you to. Okay? And I'm going to go ahead and turn this off now. And we will put that back in a bit. I want to just kind of talk about some differences for children, because it is a little bit different with children, but overall the basics are the same. With a child, you have a child victim and you are alone with that child. So say you're a parent who's home with your child, or you're somewhere that there's no one else around. If that child becomes unresponsive, again, we're starting at the beginning, checking for scene safety, making sure you're not going to be injured, checking for response. Hey, are you all right? No response, so we would call for help. If you have a cell phone, put it on speakerphone. If you don't have a cell phone, this is where it's a little bit different with a child victim. If I don't have a cell phone, I can't put it on speakerphone to call for help, but I'm going to go to the next step. Look for breathing, If they're breathing, it's a first aid emergency, and then we would just go grab the phone and call for help. If they're not breathing, we need to begin CPR. So we would do 5 sets of compressions and breaths, and then we would go get help. Hopefully, in the meantime, someone will come to be able to help us, or you can yell, say, help, someone help, and hopefully someone will hear you and be able to come. But it's really important that we get started right away with compressions on a child. On everyone, really, we want to get started right away, but it's especially important for a child because it's more common that they would be unresponsive because of a respiratory issue, whether they've choked or an allergic reaction or asthma. And so we want to get in those 5 sets of compressions and breaths, and then we would go call 911, grab the AED if we know where it is, and then use that AED and continue our sequence of compressions and breaths from there, okay? Infants, we also teach classes about infant CPR, and infant CPR is going to be just the same as for a child, and is always going to be 30 compressions, 2 breaths. So there's just one set of numbers that you need to remember. There's not different numbers for different age groups. It's always that 30 compressions, 2 breaths. With an infant, it's the same thing. If you are alone and there's no one to get help, you would do 5 sets of compressions and breaths, and then you would pick up that baby and take it with you to go call. Okay? So those are some of the basics of CPR. I want to just run through our steps one more time to be sure that we've really covered just exactly how it should look. And I'm gonna have my AED arrive after just a minute, and then kind of wrap up with an overview. Kind of the basics covered. Like I said, we teach CPR at Good Shepherd. It's a 4-hour class where we go thoroughly through adult, child, and infant CPR. You will get the opportunity to do a lot of hands-on practice. The goal is that people leave our classes feeling very comfortable and confident to do CPR. And so if you're interested in feeling confident and knowing how to do that, we really would love to have you take a class and be able to practice these skills. So I am walking outside, our stereo, I'm walking outside and I come around the corner and there's someone who has collapsed on the table. So my first step is to check for scene safety. There's no cars coming, there's nothing that's going to injure me, so I can approach, and then I would check for response. Are you okay? They're not responding. So I see a person across a little ways away, so I would send that person, go call 911 and get me an AED and come back. And then I'm looking for breathing for at least 5 seconds, no more than 10 seconds. I don't see any breathing, so convenient they have this one layer on, removing bulky layers. If they have just a t-shirt, you can leave that while we're doing compressions, but those will need to get out of the way. So we've got bulky layers out of the way. I can start my compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1, 2, back to our compressions. 1, 2, 3, 4. Oh, and someone brought me the AED. So I'm going to take it, set it on the same side of my victim, up near their shoulder, and follow the prompts.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Left side and right shoulder. Plugging in my connector.
Apply pads. Plug in connector. Analyzing heart rhythm.
Again, everyone stay clear.
Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Again, everyone stay clear.
Deliver shock now. Press the orange button now. Shock delivered.
And beginning compressions.
Paused.
30 compressions.
Begin CPR.
30 compressions, 2 breaths, and we'll continue that until help arrives and they will take over for us. Okay, so those are some of the basics of CPR, going over some of the differences for children and adults. Maybe some different scenarios that might come up that you would want to know how to address. One would be if you're alone with an adult. We talked about if you're alone with a child, you do 5 sets of compressions and breaths. If you're alone with an adult and they're unresponsive and you don't have a phone, you would begin those starting steps, checking for scene safety, checking for response. They're not responding and you have to go for help. Then at that point, you're going to leave, go get help, and come right back. Okay. We want to get started, of course, as soon as possible, but with an adult, if you're alone, you want to go grab your phone, go find help, and then come right back and begin compressions right away. If you have a victim that is a pregnant woman, we're going to just do CPR just as normal and continuing compressions. Just being sure if we have our proper hand placement where the heel of our hand is in the center of the chest, we aren't too low, we shouldn't cause any injury to that baby, and we'll just continue our compressions as normal with a pregnant woman. If someone has drowned or they have become unresponsive from being in water, we would want to start CPR just the same as what we would do for someone that has cardiac arrest. So we're going to give our compressions, 30 compressions, 2 breaths. When you use the AED, if your victim has a chest that is wet because of having been in the water, or if they're outside, they've been working in the rain, or here where it gets to be 1,000,000 degrees, if they're really sweaty, you want to be sure that the chest is dry when we apply those AED pads. I very briefly mentioned you have to have a bare chest in order to put those pads on the chest, but it also has to be mostly dry. So you would need to find some sort of rag, towel, even a shirt or something to just quickly wipe off the chest, be able to set those pads on or stick the pads on. If you stick the pads on a chest that is wet, the shock can go through that water rather than being absorbed into our victim's heart or absorbed by the heart. And so that would just divert it away. We want to be sure that they're getting the shock that they need rather than having it travel around the outside. There are a couple other little strange situations that could come up with the AED as far as the pads. One would be if you have a victim with a hairy chest and we go to put those pads on their chest and they won't stick because they're too hairy. So we might want to, or you should really kind of assess that before we put our pads on. If you see that they're hairy and you have a set of child pads, you can take your child pads, stick them on, and give them a little wax job there. Hopefully, maybe that'll wake them up. Probably not. But then we would have a bare place at least that we could go ahead and attach our regular adult pads and not have wasted those. If you do just plop your adult pads on there and they're hairy and they're not sticking, your AED will say something like poor pads contact, please readjust the pads. You can try to really squish them down to kind of move them around to get some skin contact. But if you can't, then you'll have to pull them off and your pads will be ruined. So it's really helpful if you can look ahead of time and see, yeah, they're pretty hairy. We want to, just clear that space. A lot of AEDs will have they come with a list of recommended items, but hopefully it will have a dry razor in with the kit. It should also have scissors so we can cut the clothes out of the way. But the dry razor will allow us to shave a spot just to be sure that we can get that skin contact. So if you don't have that dry razor, you can use the child pads, vice versa. Another thing that could come up as we put on our AED pads would be if they have an implanted device in their chest. So if they have a pacemaker, typically you'll see a raised lump in the center of the chest. We want to be sure that our pads are not in contact with that device. We don't have to worry about damaging that device because if they're unresponsive and it's potentially cardiac arrest, maybe that pacemaker isn't doing its job anyways, or it's failed. And so we would go ahead and put the pads on in their regular place. Just be sure if your device is here, be sure we have 2 fingers distance between that device and our pads so we can be sure that our shock is not diverted into that device. We want to be sure that the shock actually goes through the heart. And so, yeah, like I said, it's okay to go ahead and put the pads on even if they have a pacemaker. The same with other implanted devices like chemo ports, whatever else they may have there, defibrillators of different kinds. You just want to be sure that we have 2 fingers distance between any implanted device or port and your pad. So that might mean that you have to adjust a little bit, but you'll have to really consider the heart is in the left portion of the chest, right? We want to be sure that our shock is going to go through the heart. So we can't change our pad's placement to the opposite side, left side, right shoulder, because then our shock is going through just the lungs. It's not going to be effective getting into the heart. So you may have to adjust your pad placement just a little bit, but be mindful of where the heart is and making sure that our shock can actually be delivered through the heart. And then the last thing that could potentially come up, well, there's probably other things too, but the last thing that we typically cover is if they have a medication patch in that area. If that's the case, we're not going to just plop our pad over top of that patch, because that will cause much more medication than is necessary to be delivered. So we would take gloves, wearing gloves, peel that medication patch off, dispose of it, and then do a quick wipe to get most of the residue, and then you can put your pad on. But like I said, we're not going to just stick our pad over top of the medication patch. So those are some more uncommon things that could come up with an AED. Ideally, when we get that AED, we'll be able to just very quickly put it on. But like I mentioned earlier, as we begin compressions, we want to get bulky clothing out of the way. If they do still have on a t-shirt, bra for a female victim, we're going to need to get those out of the way before we can put those pads on. And so you want to be sure when we put the pads left side, right shoulder, that they are not in contact with anything on the chest, any clothing, a bra. You want to be sure that those pads are not in contact with those. And so if they're in the way, those clothing items need to be gone. So thank you so much for joining us today in our Lunch and Learn. I hope that you found it interesting, and we always hope that we never need these skills, but if you do, we want you to be confident and ready to step in. And so hope you'll be able to join us in one of our classes in the future.